Hey guys, it's Moriah from Cardinal. We're just going to talk about to all our future mamas out there with babies in their bellies, talk about, in this scary time, if you were to get COVID, what you can expect, especially if you get COVID during the last couple weeks of your pregnancy and going into delivery being COVID positive. I think it's just important to mention, we're in a weird time and we want what's best for our babies, but we also are in a little bit of a difficult balance between people wanting to see our babies and knowing the information out there. And I think it's just important to mention that if you're having any symptoms, fever, shortness of breath, chills, nasal congestion, loss of taste or smell, you need to get tested. I know that means things might come from that test. Your plans might change, but it is definitely better for you and baby and us as a healthcare team to know if you are positive, if you've had exposure, if you're having any of those symptoms, so that we can take best care for you. So if you do test positive, I think it's important right away to call your OB and come up with a plan. So you might be getting a test coming into the hospital anyway based on your OB's recommendations. So you could be asymptomatic and get a positive test, or you could have sought out testing because you were sick. Either way, a positive test kind of looks the same way in the hospital. So it's really important that you call your OB and you guys get a plan based on the hospital you're delivering at. They might have different standards, but really there are a couple different options, and it's really a shared decision with you and your OBGYN about what is going to be best for your situation and for you and baby. So, if you got COVID during pregnancy and you've gone through your 14 days and you're now asymptomatic, we know that it's very uncommon for babies, if you had COVID early during pregnancy, for babies to be born having COVID, meaning you didn't transmit to baby during pregnancy. Now, a couple babies have tested positive after delivery. It's unknown if that virus is given to them before delivery or during or after. So just keep that in mind as we talk about this. So your options, should you test positive and go into the hospital, you are going to be put in a separate isolated area, and us as staff are going to be wearing protective equipment to keep us protected from the virus as well. But your choices with baby are really what you need to talk to your OB with. So you can talk to them, really outweigh the risk benefit. So you can keep baby with you and be positive with taking extra precautions. So wearing a mask, if your room allows it, keeping baby, when baby's not feeding, 6 feet away from you, and frequent hand washing. The other option is for baby to be separated from you, but come back to you for feeding. So if you're breastfeeding, which we definitely suggest you do, or even if you're formula feeding, so that you get that bonding time to have baby come to your room when it's time for baby to feed. You have your mask on, wash your hands, feed baby either at the breast or with bottle, and then baby return to a separate area. And the third option, arguably the safest option is for baby to be separated. There is definitely a risk benefit along with mom's emotional health and the importance of mom bonding with baby. But the third option is for you guys to be separated in your entirety, in the entirety of your stay. Now, if mom is medically stable and baby is medically stable, it's not going to delay your discharge. So keep that in mind too. You are going to have a plan for when you do go home. So if you go home and you're positive and you've been separated from baby, you can continue that at home by isolating yourself in your own room at your home, but you also have to have a caretaker who has not been exposed to the virus as well, taking care of baby. And you can kind of take what you have come up with in the hospital with your healthcare provider, with your OB, and translate that to home. So if you're going to stay with your baby, when you go home, stay masked, frequent hand hygiene. And if you're going to do the isolated option, stay in your room, come out and see baby for feeds, wearing your mask and washing your hands. So I think it's important just to talk about the importance of breastfeeding. We know it's the best nutrition for our babies, but especially during this time, there's no evidence that the COVID virus is transmitted through breast milk. So it's very important that if you desire to breastfeed, to do that, and you can do that by direct breastfeeding or by pumping or hand expressing and having a separate caregiver feed bottle. So when you are pumping, if you choose to be completely isolated from baby when you are pumping, I think it's important to note that you need to also be masked. You need to wash your hands and mask before you pump. You also need to sterilize your pumping equipment after every pump, so that your baby is getting the least exposure as possible. And then if you are doing direct breastfeeding, to wear your mask and wash your hands before you do feed. But the risk benefit of breastfeeding definitely outweighs, you're giving your baby those antibodies and protecting them. So I think that's really important. And then you bring baby home and you have implemented what you started in the hospital to keep your baby safe, either with baby rooming in and you masking, keeping a distance and hand hygiene, or are you doing the modified separation with baby coming in for feeds with your mask and washing hands, or whether it be baby is completely separated. I think it's important to talk about when you can get rid of that, because COVID is not forever, and when you do recover, when you can be with your baby. So if you had symptoms, your isolation period ends 10 days after your symptoms first appeared, but you also need to be 24 hours without a fever. You can stop your isolation at that time. Still important for you to do good hand hygiene, and to keep your baby at home. Don't go around anyone, but you can be with your baby at that time. If you were asymptomatic and you never had symptoms, your isolation period ends 10 days after your COVID positive test. So, like I said, just because you are COVID positive doesn't mean you're going to stay in the hospital until your isolation is over. You will get discharged if you and baby are both medically stable, and you will have to continue the plan that you and your OB came up with at home, whether you are taking care of baby with the mask or if you're continuing your isolation in a separate room. It's also recommended that if possible you have a separate bathroom than whoever is there taking care of your baby as well. So I know that's a lot of information, and this is a really scary time, and I hope this wasn't triggering for any mommies who are out there ready to deliver. I think being educated, knowledge is power. Knowing what to expect is important, but like I mentioned in the video before, I don't want any of this to dull your joy or make you less excited for this stage in life, because becoming a mommy for me was everything, and it is everything, and you deserve to completely be just elated and excited, but keep this information in the back of your head should you have to cross this bridge. Have this video for reference, and don't be afraid to advocate for yourself, knowing that these are options, and deciding really what's best for you as a family with your OB is huge. So as always, don't hesitate to reach out to us, to call us, if it's about breastfeeding or if it's about COVID or if it's about anything. And we're so excited to meet our new Cardinal babies.